Hey guys, good morning. Dr. Sean here. We're going to do a little mailbag segment this morning. I got to ask Doc, what do you think about OCD, obsessive compulsive disorder, specifically in regards to excessive repeated hand washing? You know, nervousness, can't get around it, right? And it asks a little bit further about, does it have something to do with serotonin levels? Is there some kind of a deficiency? We're too far away for an appointment. What can I do to help someone, a dear person or friend with this terrible issue? And thanks. Okay. So let's break it down. First things first, obsessive compulsive disorder. Start thinking about that, right? Obsessive compulsive, it's a neurosis to some degree. It's an anxiousness. It's an anxiety. So we immediately say, well, gosh, it's got to be tied to blood sugar and blood sugar swings. Now we look at blood sugar swings and we know when the sugar goes too high in the blood too fast, the body will go into a hyperglycemic state, which is a state of anxiousness. So anxiety, moody, irritable, fidgety, a little obsessive. If it goes down too fast, we go the other way. We get depressed, we get fatigued, lethargic, and forgetful. You got glasses on your head and you're looking around for your glasses, right? You've got your car keys in your hands and you're trying to find them around the house. You know, little things like that. It likes to hit you at certain times of the day. The times are usually mid-morning, mid-afternoon, early evening. 10, 11 in the morning, 2, 3 in the afternoon, 7, 8 o'clock at night. You'll just, you'll hit that wall and you'll be tired. 20, 30 minutes and your body will tough through it. It'll rebalance, reestablish control over that mechanism, and you get your second wind. So if this is what we're talking about, then we look at obsessive compulsiveness. Now, is there an emotional factor to this thing? You know, you can see my poster behind me here. If I move out of the way, you can see stress is the cause of all disease. And I always say there's mechanical, emotional, nutritional causes. There's 3 of them. You got to look at them all. You have to look at all of them or you'll miss it. Now, here's the ticket to this one, so let's go through it. How about the serotonin? Serotonin, guys, is it's a hormone precursor, right? So like a neurotransmitter. And what ends up happening with these things, they have effects on the brain. But here's the key. Your brain doesn't make them. It absorbs them. It pulls them out of the bloodstream up. How do they then get into the blood? They come from the gut. That's the secret to most of your OCDs, your type A personalities, your obsessive compulsive, your ADDs, your ADHDs. It comes from the gut. So melatonin, serotonin, all your neurotransmitters come out of here, out of your diet, what we eat. So now we're back to, diet affects that blood sugar swing. If you can seal the gut, if you can heal the gut, if you can give the body what it needs, you can stop the big swings. If you stop the swings, all of a sudden that compulsive nature starts to drop. We've seen this with bipolarism. We've seen it with schizophrenia. We've seen it with ADD, ADHD, autism. All these things have a gut link. Ironically, so do all the autoimmune disorders. So it makes you think, holy cow, that GI tract is really important. So where do we go with this sort of thing? So is it a deficiency of something? Yes and no. It's not going to be one chemical. It's going to be a blend. So I personally, in practice, I would run an IUP, an integrated urinalysis panel. That's where I would start. Run that IUP and see what is the body holding on to, what is it throwing away. Run an epigenetic profile, a body audit, and see where you're spending your energy and your resources. If there's a glaring hole, you know, oh my gosh, I've got to repair there. I have to support that system. It's getting pushed too hard. Now, here's the other kicker to this. There's no cookbook treatment. There's no generic, we'll take this for that, right? Because as we know, this for that is nothing but a Band-Aid. Now, it may symptomatically help a little bit for a while, 2, 3, 4 months, and you're right back at it again. And everybody out there on antidepressants, anti-anxiety meds, all these things, you pretty much have seen that, haven't you? Man, it worked great for a while, and then it kind of quit. And I'd take a little more, and I kind of quit, and I'd take a little more, and then they changed it to a different one. That's what happens, right? Because you're never really getting at the cause. So when we're looking at something like this, we go back to the basics and we say, okay, what do? You run an integrated urinalysis panel. I do these for physicians and patients all over the world. So there's nowhere in the continental United States that we can't run this easily. So that's the first thing. So that doesn't matter. Distance doesn't matter. The next thing you look at is once you get that figured out, you alter the diet a little, shift it. Try to rebalance and regulate that hormonal swing, because blood sugar, guys, is a hormone-based game. Cortisol, insulin, glucagon, they're all part of this thing. Balance those. You can do some of that with diet from a distance. See what happens. Give it a week, 2 weeks, a month, and see what happens. At the end of that, you reevaluate. You run the IUP again, see what's changed, see how the patient's feeling. And then you can get into the emotional side. And what's really cool about energetic psychology, which we do a lot of work in that field, when you get into the emotional work, the quantum world, you don't have to be here to do it. We can Skype, we can FaceTime, and you can get the same results, which is really exciting, right? So you can do things from a distance. So when you've got a lab and you've got supplements and a dietary change that we can do from a distance, and then we can do emotional work from a distance, sometimes you can see miracles. It's kind of exciting, isn't it? So I'm glad that you guys sent this in for a mailbag. If you have anything else, make sure you like, share, and post this to your friends. I'm Dr. Sean, the Robin Hood of Healthcare. Take care.